Well, thank you very much, and good afternoon. And it is a great pleasure to be able to share some thoughts with you. Nothing is going to be as profound as a Leonard Cohen quote, just to manage your expectations. But you know, I was thinking, it was coming down about in a previous life when I worked at Ulster Television. I made a documentary once about a charity called Shine a Light. And it was a one-man band, a guy called Billy McCrory, and what he did was he arranged for treats and trips for children with cancer. So it was a very kind of serious thing. And when I made this documentary, one of the young women that I interviewed talked about recovering in hospital after her procedure and how depressing it was to wake up every morning to the sight of these blank beige walls in her hospital ward, and how stimulating it would have been if there'd been some creative art on those walls, because it would actually have aided her recovery. And as Minister of Health, I am now very focused on the fact that particularly after Christmas there, we had this huge problem in our acute hospitals of the flow of patients coming through. So the problem was being manifested in the emergency department, but actually it's the whole flow, getting people out what we call the back door and back into the community or back home. And I think creative photography and art absolutely has a role to play. And I'm also very focused on the fact that our health is closely linked to the conditions that we endure every day in terms of where we're born, where we grow up, where we live, where we work and grow older, as well as, frankly, and we're a quarter of the way into the 21st century, so it is remarkable that we're still saying this, inequities in terms of power, in terms of money, and in terms of resources that are available to individuals. These are, of course, the social determinants of health, including mental health. So I'm a big fan of Professor Sir Michael Marmont, who you may be aware of, and he says, don't talk about the causes, talk about the causes of the causes. So don't just focus on the fact that smoking causes cancer. Ask me about what causes people to smoke in the first place, because that's where we're going to make a real difference. And the mental health and well-being of our population, therefore, is not just a health and social care issue, it's a societal one. And good mental health is linked to good physical health. It's also linked to positive relations with your families, with your friends, with your colleagues. It enables us to fulfill our potential, to engage in community life, and lead full and rewarding lives. And I believe the impact of mental ill health goes well beyond the health of the individual with the diagnosis. So as a society, I think we need to continue to provide opportunities, not just for individuals, but also for communities, to look after their own emotional well-being and their own mental health. And it's encouraging to hear new and innovative ways that we can approach this, including through the medium of photography. The benefits of art therapy and art psychotherapy are very well known. In situations where people are dealing with emotions that are too distressing or too challenging to articulate in words, art therapy and psychotherapy provide another medium by which people can articulate and express themselves. And again, I think back to the time I spent as a commissioner for the victims and survivors of the conflict and the many voluntary and community groups who tried to help them. And often it was through non-verbal processes, including the arts. And you may be aware there are quite a number of quilts now, and each square in the quilt represents somebody who lost their life in a conflict-related incident. And it crosses all boundaries, and I think it reflects the common humanity and the human cost of what we did to each other over that ghastly 50-year period. So in terms of moving forward, we've got a clear strategic direction for mental health, and that's the Mental Health Strategy, published in June of 2021. It sets out a 10-year vision. It's a vision to improve provision in Northern Ireland, and it seeks to ensure that we have world-class services, both to treat those who need care, but also in helping to prevent mental ill health in the first place. The first theme, which is promoting mental well-being, resilience, and good mental health across society, is key to ensuring we reduce the stigma around mental health. And that stigma as I'm sure you know, still exists. Early intervention and prevention are key to this, to ensure the provision of the individual support required through the patient journey. The second theme, providing the right support at the right time, focuses on a range of person-centred improvements, including, for example, improvements in child and adolescent mental health services, but also in community health, in inpatient services, and in specialist services. All of these, I think, are essential components of delivering the best mental health services for the many individuals and families who are impacted by a mental health diagnosis. The third theme, new ways of working, sets out the changes that will support the improvements which are needed right across our system, including the development of a single mental health service, workforce planning, and research. And you know, people often say to me, why is it, given Northern Ireland's geographically small and the population is less than 2 million, why do we have 5 geographic health trusts? And the answer to that is I'm not really quite sure. I don't think if you were starting with a blank page, you would do that. But actually, to do that reform piece, I believe would just be a distraction in terms of service delivery. And if you remember when Professor Bengoa came first in 2016, his report was systems, not structures. So I'm not tinkering with the structures, but I'm simply saying to the people running the 5 trusts in my mind, you are one, and I expect you to cooperate and collaborate and to deliver standardized regional services so that we can abolish this idea of a postcode lottery. So in each of the themes in that mental health strategy, art therapy and art psychotherapy provided in Belfast Exposed, other community and voluntary organisations and in our schools, you can all make a real difference to the mental health of those you engage with. And that's why events such as this one highlight the provision available to those in need, and that's really important. And those who would benefit from healing through photography, that's also an important message to get out there. So while considerable progress has been made to progress key actions in that mental health strategy, alongside the delivery of a range of other actions, they are being progressed within a constrained budget, and I'm sure you've heard me many times talk about the difficulty of our budget. The funding plan, which was published alongside that strategy in June of 2021, identified a requirement of an additional £1.2 billion pounds over the 10 years of that strategy to fully deliver all 35 of its action points. So we're now in year 4, and the strategy's never received the funding required. Just over 16 million of additional funding has been allocated in that time against a requirement of £76 million. And in the financial year just passed, 5.9 million was allocated towards mental health in 2024-25, but the estimated requirement for that year just passed was £42 million. So 5.9 against 42. And as a result, I'm afraid the strategy is being implemented on a year-by-year basis with year-on-year priorities, which are very much linked to that limited funding availability. So in the current year, focusing on those actions which are enabling our priorities are as follows. I'll give you 4. A continued focus on early intervention and prevention, developing a plan to maximise the role of the community and voluntary sector, continued development of the regional mental health service, and stabilising and growing the workforce, all very important. Good progress has taken place despite the challenges, and I'll highlight just a few of those if I may. Actions 1 and 2 of the strategy focus on mental health promotion, on early intervention, and of course on prevention. And the Public Health Agency led a collaborative process to develop the early intervention and prevention action plan to take this work forward. The plan details actions relating to cross-sectoral and cross-departmental working, communications and public awareness, improving access to information, resources and support, and creating supportive environments through a settings approach. So we work in partnership and we support the community and voluntary sector to undertake service activity in this area. That's been key in successful progression. Indeed, the community and voluntary sector play a key role in the delivery of mental health services, and we want to ensure we're maximising their contribution to support and enhance service delivery. Action 17 of the mental health strategy, therefore, committed to a review of the scope, the scale, and the capacity of the community and voluntary sector. I'm pleased to say the findings from that review will be finalised in the coming weeks, and that will get us to a potential roadmap to maximise the future contribution of that really important sector. Then, in recognition of the staffing challenges in mental health, Action 32 committed to a comprehensive workforce review, considering existing workforce needs and training, and the aim was to develop a new workforce fit for the future. It was identified as a key enabling action, setting the foundation for the wider implementation of that strategy. It was led by an external review team on behalf of the department, and it involved extensive engagement with stakeholders and data collection, and that was done over a 12-month period to help inform the development of a future workforce model. The review report was published in July of 2023. It made 18 recommendations right across a number of key themes. Importantly, the review provided the opportunity to grow the participation of some professions that were limited or absent from the current workforce, to align with other jurisdictions, and to clearly identify new roles that could be integral going forward. And these include an expansion of allied health professionals, amongst others. There's an expectation and opportunity for new roles to emerge in the coming years, where the health and social care system has limited access to specific types of skills and requires more diverse options to fulfill the skills needed by the services. I want to thank you for giving me this opportunity to share some thoughts and to review where we're getting in terms of the mental health strategy. But I kind of want to finish where I began. Photography, arts and generally, stimulate. And I think that's really important, whether it's the recovery of a young patient in a hospital waking up to those beige walls every morning, or in prevention and in early intervention. So when it comes to mental ill health, I think what you're discussing today is not some sort of bolt-on. I think it's a really important, essential element in a very complex mix of what it requires to deliver world-class healthcare delivery. So I thank you very much for your interest in this. Thank you for the opportunity to share a few words. Thank you very much.